Welcome. Have you ever woken up with a sharp, stabbing pain in your eye, like something scratching at the surface? You might be experiencing corneal erosion. This video will delve into this often overlooked eye condition, explaining what it is, what causes it, and how it's managed. We'll guide you through understanding corneal erosion to help you protect your vision. So, what triggers corneal erosion? The causes are varied but often stem from previous corneal injuries. These can include abrasions from foreign objects, like a twig scratching your eye, or even poorly fitted contact lenses. Another common culprit is corneal dystrophy, a genetic condition that weakens the corneal structure. In these cases, even a seemingly minor event, like rubbing your eye, can trigger an erosion. To understand corneal erosion, let's look at what happens within the cornea itself. The cornea, your eye's clear front window, has several layers. In corneal erosion, the topmost layer, the epithelium, doesn't properly adhere to the underlying Bowman's layer. This faulty adhesion means the epithelium can easily slough off, exposing nerve endings and causing intense pain. Think of it like a poorly glued tile on a floor, easily dislodged and leaving a rough, sensitive surface. While precise numbers are difficult to obtain, corneal erosion is a relatively common condition, particularly among individuals with a history of corneal trauma or dystrophy. It affects people of all ages and backgrounds, but those who have experienced previous corneal injuries are at a significantly higher risk. Contact lens wearers are also more susceptible, especially if they don't follow proper hygiene and wear schedules. The telltale signs of corneal erosion usually involve a sudden onset of sharp eye pain, often upon waking. This is because the eyelids may adhere to the cornea overnight, and the movement during opening can pull off the poorly attached epithelium. Other symptoms include a gritty sensation, excessive tearing, blurred vision, light sensitivity, and redness. These symptoms can fluctuate in intensity and may even resolve on their own, only to recur later. Diagnosing corneal erosion usually involves a comprehensive eye exam by an ophthalmologist. They'll use a slit lamp microscope to examine the cornea closely, often using a special dye called fluorescein. This dye highlights areas where the epithelium is missing, making the erosion visible. Your doctor will also ask about your medical history, particularly any previous eye injuries or contact lens use, to help determine the cause. Corneal erosion can be broadly classified as primary or secondary. Primary corneal erosion refers to cases caused by inherent corneal abnormalities, like epithelial basement membrane dystrophy. Secondary corneal erosion arises from external factors such as trauma or infection. Furthermore, corneal erosion can be categorized as recurrent or persistent, depending on the frequency and duration of symptoms. Treatment aims to promote healing and prevent recurrences. Initially, lubricating eye drops and ointments are used to keep the cornea moist and reduce friction. In some cases, a bandage contact lens may be placed to protect the cornea and facilitate healing. For more severe or recurrent cases, procedures like anterior stromal puncture or diamond burr polishing may be considered to create a stronger bond between the epithelium and the underlying layers. In resistant cases, phototherapeutic keratectomy, or PTK, may be used to smooth the corneal surface. Preventing corneal erosion focuses on minimizing the risk factors. If you wear contact lenses, adhere strictly to your eye care professional's instructions regarding hygiene, wear time, and replacement schedules. If you've had a corneal abrasion, follow your doctor's recommendations for aftercare and consider using lubricating eye drops to prevent dryness. Protecting your eyes with appropriate eyewear during activities that pose a risk of eye injury is also crucial. The prognosis for corneal erosion is generally good, with most cases resolving with appropriate treatment. However, recurrences are common, and some individuals may experience chronic symptoms. Recent research is exploring new therapies, such as the use of amniotic membrane transplantation and advanced bioengineered corneal substitutes, to improve healing and reduce the likelihood of recurrence. Ongoing research is also focused on understanding the underlying genetic factors that contribute to corneal dystrophies, paving the way for potential gene therapies in the future. Consult with your eye doctor on the best plan to treat and manage your specific case.